At first, when I went into general surgery, it felt depressing. I know you people will be like, what? But
तो रुको जरा सबर करो.
hello everyone, I'm Shalja doing my internship in PMR Medical College. We have been posted in general surgery. We'll be having alternate OT and OP days. On the first day, we went to OT. It was all good, wearing scrubs, shifting patients, seeing whether they got pre-op medications, assisting surgeons. Of course, all we did was holding retractors and placing some small stitches at the end of the surgery. But it felt really great. All those hours of standing will be gone with that stitch we placed. Sometimes it will take more time than we usually expect, so we all got used to carry some food with us. After the OT, we'll be shifting patient to post-op, checking their vitals, then we'll be going rounds with our professor. First day went really great. Then comes OP days. Seeing patients, taking their history, examining them, it all felt beautiful. How can we forget trauma cases? We'll be the first one to see them, checking their GCS, taking fast actions, cleaning their bleeding wounds. It all feels like we are not students anymore. It is all different from the previous 4 years. We are actual doctors. But
Wait a minute.
didn't I tell you that surgery was depressing? I'll tell you what made me think that and what actually changed me. But before all that, as today is the last day in this department and it is also Teacher's Day, we along with our PGs thought to celebrate this to honor our professors who teach us many things. I'll tell you the story while I'll be showing you the time lapse of all the decorations we'll be doing for the Teacher's Day. So as far as I told you till now, it all went good. OTs, OPs, rounds and even
Elements
trauma.
of night duty. No sleep. No time to fresh.
But dressings, especially those ulcers, that too infected ulcers, while cleaning them we have to scrape till it bleeds, like actual bleed. With those screams, that cry of pain that we while we scrape and pouring H2O2, it was like, nah, I can't do this. I told my senior, sir, this is too painful. I can't do this. This is so depressing. Aren't we really doctors? Aren't we healers? Why are we creating them? Why are we giving them pain? He was like, this 5 to 10 minutes pain will help them not to lose their limb. Once see after healing, they'll be happily walking. Yes, I saw my very own eyes those patients with cellulitis, with fasciotomies done, with their raw skin opened, with pus, with everything. But after weeks of dressing, sometimes skin graft or tension suturing, but after all this, after a few weeks, this whole leg and everything becomes really so normal, no traces of any infection. Then I felt surgery isn't depressing. Surgery is a ray of hope, a second chance to those who forgot to take their TTs, those who neglected their injuries, those who neglected their small wounds. This surgery is really a second chance. So this is your reminder never to miss your TT shot even after some small minute injuries. Here we are done with our decorations. So this is the final look. We thought to felicitate our professors. We brought some mementos, shawls and some cute little plants just as a symbol of life they are spreading to their patients. To make this day even more sweeter, we made our professors cut the cake. And the thing is, if I won't take surgery as my PG, these days will be the last for me to be in this branch with these professors. So I want to share what this branch and our professors teach me. First thing, Healing takes time. Yes, it won't happen overnight. Slowly, day by day, you'll get better. But don't stop in between. And the second thing, you can't guess what happens next minute. One morning, you'll be fine, completely fine, just went for bath and slipped. And now, you need some 15 stitches in your ankle. Yes, this was my patient. Yeah. And you are just riding a bike, met with an accident, and now you may never have your functions back. Yeah, so we can't guess what happens next minute, so be grateful for what you have right now. And the third thing is wound care and suturing. Dressing wounds daily, removing sutures, or learning different types of sutures taught me that minor procedures matter as much as big surgeries. Proper wound care prevents infections and improves healing more than we think. And next, case sheets and documentation. Writing case sheets, progress notes, and discharge summaries seem like paperwork at first, but I understood it's actually the backbone of communication between doctors. It reflects patient's progress and protects his legally too. Operative care. That is, surgery is not just about cutting and stitching. I learned how crucial pre-op optimization, like fitness for anesthesia, controlling comorbidities, giving pre-op medication, and post-op monitoring, like fluids, vitals, drains, pain relief, are all for recovery, not just surgery. Then discipline of time. The operating theaters runs like a clockwork. Surgery showed me how precious time is, whether in an emergency laparotomy or simply being on time for ward rounds. Minutes can mean life or death. And punctuality is not just professionalism, it's respect for patients and your colleagues. The next thing is stamina and endurance. Long hours in the OT and sleepless nights and night duties tested my limits. Standing for hours with retractors, running between wards and casualty, I discovered that surgery is as much about mental and physical stamina as it is about skill. It trained me to push through fatigue, stay focused, and still be kind to the next patient who walks in. And attention to small things. Changing a dressing, securing a drain, writing vitals, or removing sutures may look like small tasks, but they are the silent backbone of surgical care. I learned that neglecting these small details can cost a patient dearly, while doing them well brings healing and comfort. Surgery taught me to respect even the smallest responsibilities. And the main thing, staying calm in chaos. Emergencies were the true classroom. A bleeding wound, a crashing patient, or an unexpected complication in the OT showed me that panic has no place in medicine. The best surgeon remains calm and focused, making decisions with clarity even in chaos. This mindset slowly started shaping me too. So all this celebration, these felicitations are just a small gratitude gift to our professors who taught us many things, who shaped us like this. So after celebrations, we had some small lunch, and in this way, let me say bye bye to general surgery.